It used to be that the textbook said that thyroid disease wasn't very common in the United States, but since in 1995 they showed that a big study showed that over 12% or around 12% of the people had high TSH levels or abnormal TSH levels. But we know that what shows up on a blood test is just the tip of the iceberg. There's far more people that have thyroid responsive symptoms than will show up on the blood test. So they showed that since 1950, the incidence of autoimmune thyroiditis has gone up considerably. And the incidence of congenital hypothyroidism has doubled in the last 2 decades. So why is the thyroid disease increasing so quickly now? One possible explanation is that there's more toxins in the environment, and the thyroid is very sensitive to toxins. So the pesticide use has increased by 40% in the U.S. Increased tenfold in the last 40 years, tenfold. And these toxins are showing up in the blood work of normal adults. I'm going through this kind of quickly, as you can see, because there's a lot of slides and only 30 minutes. So, but it's showing up. These toxins are showing up in the blood of normal adult people, average people that are not even in toxic situations. And sadly, even normal babies are being born with numerous toxins in their system. Glutathione is really important in helping the body fight these toxins. And when the toxins get so high that the glutathione is consumed, then the glutathione can't protect the thyroid as well. Glutathione is important in keeping hydrogen peroxide levels low in the thyroid gland to protect the thyroid system. But when glutathione is used up, in this, normally glutathione keeps hydrogen peroxide levels very low, almost zero here. And hydrogen peroxide with thyroid peroxidase oxidizes the iodine so that it can go into the thyroglobulin. But if this glutathione is used up, then there's nothing really to keep these hydrogen peroxide levels down. And the oxidative stress in this whole system can go much higher. And that could affect the sodium iodide symporter. It could affect thyroglobulin, thyroid peroxidase, and the follicular cell itself. And this oxidative damage can invite autoimmune thyroiditis. So you can see that a little bit of toxins, a little drop in glutathione, and you could easily have more autoimmune thyroiditis. I think you've heard before that halides can decrease the uptake of iodine in the follicular cell. That's one way that they can be toxic. And there's a lot of animation on this slide here we don't need. It's the bromines and fluorines. It's found in drinking water and a lot of our soft drinks today. Some things that decrease the conversion of T4 to T3. As you know, stress. And one of the most stressful things that you can go through is medical school. I don't know if you remember that being very stressful. But when they did a study, and when they had final exams, the reverse T3 levels were at their very highest at the final exam time. Multitasking, very distracting and damaging to the system. Stressful. Trauma, chronic illness, alpha-lipoic acid, a very strong antioxidant, but even that can impair conversion. Heavy metals can cause problems. And one thing that you may not have heard of is hyperinsulinemia. Can also impair conversion of T4 to T3. So just think about those people that are having hyperinsulinemia, and then on top of that,